Hello to my 35-week friends. You're in your last month-ish of pregnancy and you're probably starting to feel overwhelmed and wondering what you've forgotten. Today, I'm here to give you a checklist of things to remember as you head into that last month. So let's get going. Now, this checklist might be a little bit different than other ones that you see online. I don't focus so much on baby. In fact, I think that there's very little that you need for a newborn. But if you want a video on the necessities for a newborn, I'm happy to make one, so tell me down in the comments. But there's a lot you need to get ready and gather before you have your baby, so I'm excited that you're here. As a note, I have had 3 babies of my own, plus I've seen thousands of people have their baby in my 20 years in labor and delivery at the hospital. So I'm really glad that you're here to learn about that last month of pregnancy. Okay, let's jump into the list. And don't feel like this is your only resource. I actually have a whole 3rd trimester checklist that comes with the newborn necessities, postpartum planning, birth prep. It has so much good information. I'll put the link down below so you guys can grab it and it'll just head into your inbox. Okay, let's get going on the list. The first thing you need to do is to make sure that you're scheduling out those prenatal appointments. Some of you might even be seeing your doctor twice a week, which yes, I feel like you see your doctor more than you see your husband, but you want to make sure that you're getting those appointments, you have them on your calendar so that you're getting them done in that last month. I know it is tempting to skip them, but I am here to tell you that especially in those last month, those appointments are important to catch anything that's going wrong with you or the baby. So schedule them out in advance. I think you'll really appreciate knowing when they're going to be so you can get everything arranged during that last month. The next thing is to make kick counts a priority. Now, this is a huge soapbox on my channel. You'll see lots of videos about it. I'm sure I can put one of them up above, but kick counts should be started in your 3rd trimester, and they are your best indicator of fetal well-being. Now, there's a lot of misconceptions about kick counts. You're looking for how long it takes your baby to give you 10 movements. Now, if you have more questions, I'll put some more videos down below, but make sure that you're still doing your kick counts. Your risk of a stillbirth starts to increase as you head into that last month of pregnancy. So I really want to make sure you're doing all that you can to prevent it. And that way of doing stillbirth prevention has actually shown to decrease stillbirths by 33%. Yes, you heard that right. 1/3 of stillbirths could be saved when you do kick counts correctly. So make sure that you're doing them right. And yes, I am shocked by how many providers tell people how to do them wrong. And if you're over there thinking, Hillary, this is good information, if you guys could like this video, it really means a lot and it helps YouTube know that this is high quality pregnancy content that they should be showing to other people so that we can help them as well. And while you're down there, don't forget to subscribe because I'd love to hang out with you for the rest of your pregnancy. I push videos frequently, like 3 times a week right now, so come join me. Okay. If you're 35 weeks, you're going to be having your GBS test done soon if you are in the United States. Now, why they don't do it in other countries, I'm not really sure, but it's a pretty cheap test. And GBS, group beta strep, has been shown to be problematic in some babies after birth. And so in the United States, we test for it, and moms who show up as positive usually are given antibiotics during labor. So just so you know, it's going to happen at around your 36-week appointment. It involves a Q-tip and the birth canal. And side note, people are not prepared for this one, but there is a quick little circle of your rectum right when they do the GBS testing. So I'm here to save you from that ugly surprise. It's important that we do the testing there because that is where all the bacteria are coming from. And by the way, I'm glad that I asked you to like and subscribe before I brought that part up, but I'm here to give you the real truth. Okay, now is the time to finish or start a birth class. Birth classes have been shown to reduce C-section rates, reduce induction rates, and increase birth satisfaction across the board. I recommend the online prenatal class for couples. It truly is the easy way to get you prepared for your hospital birth. I recommend people finish it by about 34 weeks, so you're really in that time frame that you should be finishing it. I see birth classes on here that tout like hundreds of hours of birth class information, but I really think you're looking for one that gives you the basics of what you really need to know. And again, I'll put that link down below. Now, you might have noticed that I talk about 3rd trimester testing in my birth class. I honestly think it is a lot of time where things go off the rails and people end up having a birth that they weren't prepared for because of the results of 3rd trimester testing. So when you understand 3rd trimester testing, it really gives you a great foundation so you can talk with your provider more if they order it for you. Basic 3rd trimester testing looks like preeclampsia labs, a BPP, NST. Again, I talk about them all in my birth class, but if you guys would like a quick video about those, tell me down in the comments and I'd love to make it for you guys. Pro tip, Even if third trimester testing shows that things are starting to look a little bit different, it still is your decision always if you are going to be induced. Hopefully you have a great relationship with your provider so you can discuss with them both your birth priorities and how the baby's doing to make a choice that is best for all of you. Okay, if you're 35 weeks, it's honestly still a little bit early for baby to be born, and I'm sure there are still like some 33 weekers watching this video as well. You want to learn about preterm labor signs. Now, I have a whole video about the early signs of labor that I'm going to link to both above and down below. It's a great one to get you started, but you're still too early to be going into labor. So if you have those signs, you want to call your provider. This is a great question to ask at your appointment about what you should be watching for you and what you should do if you see those problem signs. Some providers have someone on that can take calls for them 24/7. Some recommend calls go to labor and delivery, and some just tell you to go into labor and delivery. So you're going to want to know which your provider recommends. Okay, now you're going to want to get your hospital supplies for your hospital bag. Now, I believe one of the best gifts you can give yourself is not overpacking that hospital bag so that you then have to put it all away when you've had a baby, you're already postpartum, and a lot is already going on with yourself. So I personally believe in a very minimalistic hospital bag. I have a whole video on the essentials that I'll put down below, but if you guys want me to make a video of a simple hospital bag, I'd love to do that for you. Tell me down in the comments. Now, along with hospital supplies, a lot of people ignore the fact that you're going to need supplies for yourself postpartum. There is a lot of bleeding that happens after people have a baby. I think most people are very surprised by how much blood comes out, and I actually recommend to buy a pack of Depends to have at home, mostly to prevent leaking because I am not a laundry girl. Anything I can do to avoid laundry, I'm here for, so I really don't want to change my sheets in the middle of the night if I've leaked outside my pad. So a pack of Depends can help give you that safety so you're not washing as many sheets. And then you probably want a pack of night times and then a daytimes because your bleeding will start to taper, sort of like a period. Most people's bleeding stops about 3 to 5 weeks after they've had their baby. Some people go all the way up to 6 weeks, although usually it's just spotting when you get to that point. Pro tip, if you're postpartum and your blood starts to increase, that shows that there is a problem sign. And we're going to talk more about postpartum warning signs, so keep watching. Okay, now is a great time to get that birth plan or birth preferences, which I prefer, and a postpartum plan set up. I actually have links to both of those little printables that you guys can fill out and really start to think about how you want to manage your pregnancy and who can help you after you have the baby and what you want your postpartum time to look like. So many of us spend so much time preparing for the birth, kind of like couples preparing for the wedding, that they really aren't prepared to live together after they have the wedding. So this kind of gets you prepared for the after part as well. And again, I'll put links to both of those down below. They're totally free. Okay, this one sort of catches a lot of people off guard, but you're going to want to choose a pediatrician. Some people think their OBGYN will just see the baby in the hospital, but I am here to tell you that actually the OBGYN has basically no knowledge about babies. That is not where they specialize. Now, if you have a midwife, they can actually see the baby, or if you're delivering with your family practice doctor, you could have them see after the baby as well. However, most people need to have a pediatrician, so check your insurance, call around. I really recommend having a pediatrician that's close by because you're going to see that pediatrician quite a lot in the beginning. And if your baby's sick, you really don't want to be traveling a long ways in order to see your provider. And they will ask you for the name of your pediatrician when you get admitted to the hospital. I actually have it on my birth plan so that it's already written down for them. It's so handy. Fun fact, I actually worked for a pediatrician. That was my first job as a nurse. If you guys want a video on how to pick a pediatrician, I actually have some really interesting insights since I worked for a pediatrician. If you want one of those, tell me down in the comments. Okay, this is one that a lot of people ignore, but especially first-time moms, I recommend that you take a breastfeeding class. Now you're like, Hillary, I just took a birth class. Now the online prenatal class for couples, if you purchase the bundle, does include a breastfeeding class taught by an IBCLC because Hillary, not so great at breastfeeding. And I really think that a simple breastfeeding class can be really helpful as you head into having your baby. Breastfeeding is not something that we talk a lot about in society. It catches a lot of people off guard. So if you just know the basics heading into breastfeeding, I think it can be a big win. I have mine taught by an IBCLC because she also can give you tons of information and help after you have your baby. It's Katie from the Breastfeeding Mama, and I think she has great information. But I do think new moms, especially first-time moms, should be taking a breastfeeding class. A simple one. We're not talking hours of information here. Mine is under an hour, I believe. Of course, I speed everything up. Are you a 2-timeser? Tell me down in the comments. Okay, now is the time to figure out anything you're missing for what the baby needs. Hopefully, if you're having a shower, you've had it by now and you can start to realize what spots you need to get things. And again, I'm here to tell you that newborns actually need very few things. So don't feel like you have to buy, like a lot of people I'm seeing are buying the high chair and an exercise saucer and like all these different things. Really focus on what your newborn needs, and then maybe you can look at the rest later on. And again, in that 3rd trimester prep pack, I actually have the baby necessities. You guys can get that and print it out down below. Okay, here's something that I don't hear a lot of people talking about. You can actually prepare your cervix at where you're at. Around 36 weeks is a time that you are safe to start doing some things that can help prepare your cervix in case you get induced or just for labor in general. I have a whole video about it. I'm gonna put it down below, but I really believe that these are things that can help end up preventing a C-section if you need to be induced early, or can help your cervix just be more ready for actual labor. They're simple things. I'm not saying you need to do all of them, and you're definitely going to want to check with your provider before you do any of them, but check out that video down below. In case you're like, Hillary, please give me the cliff notes. They include pumping, primrose oil, dates, and sexy time with your partner. But like I said, not all of those are right for everybody, so make sure that you check out that post and talk with your provider before you start any of them. Okay, like I said before, there are postpartum warning signs, and these are so important to know before you have your baby. In fact, I think they're important for your partner and your mom or anyone that's going to cocoon you after you have your baby. Once baby is born, it is going to be so easy to ignore problem signs of yourself. Things like headache, difficulty breathing are really easy to just say, oh, I just had the baby, it's not a big deal. But ultimately, they can be really big problems that you need to go to the ER for. We spend so much time looking at the baby, preparing for the baby, thinking about the baby, when in reality, mom also needs to be watched over. And having people in your surroundings who know what to watch for and can say, you know what, you're saying you have a really bad headache, I think we should call your provider, is so good for you. So learn the postpartum warning signs. If you're like, Hillary, where the heck do I learn those? I actually have a free class called Postpartum Care Made Easy. It's included in the online prenatal class for couples, a video walkthrough of all of them. But you can get the basic class totally free. I'll put the link down below, but learning those postpartum warning signs is super important, and also knowing them for friends later on. It's something like, I think we all know CPR. I wish all of society knew these postpartum warning signs so we could help new moms be healthy. Now, finally, I'm here to tell you that you are in a tricky spot. It is hard to be so very, very pregnant. So I want to make sure that you are taking care of yourself, not forgetting self-care in this whole thing. Make sure that you're being kind to yourself in that last month of pregnancy. It is not fun, and the more naps you can get, I think that's a really big win. I know that I really tried to push myself, and I wish that I hadn't. I wish I had been kinder to myself, realizing that I was growing a whole other human inside my body. I deserved kindness. And if you need to tell your partner that, feel free to let them watch this video. In fact, come join me in the online prenatal class for couples, because we talk about all of this a lot. Okay, now there are still a lot of mistakes that people can be making. I'm going to share my biggest mistakes right here. I don't want you guys to be making them, so make sure that you watch this video. I hope this list gave you guys some ideas of how to get prepared for your upcoming hospital birth. I'm so excited for you guys, and I'm glad that you're here with the Pregnancy Nurse, where we get you prepared, not scared.